Listen up, there is a recall on certain breast implants linked to a very rare type of cancer. Here to explain more, Dr. Reza Sadrian. Dr. Sadrian, good morning and thank you for being here.
Good morning, Shelley.
I was reading some of the articles about this. It's concerning for women who may have breast implants.
Correct.
Tell me a little bit about this. What is this recall?
So just to put everything in perspective so people don't panic all of a sudden, you know, breast augmentation with implants is a very, very common procedure.
It's the #1 procedure,
isn't
it?
It's a number one
women?
surgical procedure.
Okay.
Exactly, cosmetic surgery procedure. Over 10 million people worldwide have breast implants. In the U.S. alone, over 400,000 women every year get breast implants. So when you look at the entire number, there is no relationship between breast implants and breast cancer itself. However, as of 2011, we've known that there's been a link with breast implants and a certain rare type of lymphoma, which is a cancer of the immune system. And over time, we've learned more and more about this. We've gotten more and more reports of this. Even as early as May of this year, the FDA did not feel that the number was high enough to justify removal of this type of specific implant off of the market. However, with the newer reporting, the increased number, currently, to date, we have 573 cases of this type of lymphoma, and there have been 33 deaths because of it, associated mostly about 80% with a specific type of textured implant made by Allergan. It's called the BioCell textured implant. So therefore, the FDA felt it was justified to ask the Allergan company to remove this, and they voluntarily removed it yesterday.
You say this, I know that there's a lot of people that may have done the breast augmentation, but if you're one of those 33, the families of those who lost their lives or have developed cancer from this, I can imagine it would make you very upset.
Absolutely, of course. So it's very important to find out, if you have breast implants, to find out what type of implants, because of all the implants, only about 10% are textured. And of this particular type of implant, there's only 5% of the implants that were made with this specific company, BioCell.
So if you're watching today, or you know somebody who may have had a breast augmentation, they do have breast implants, what do you do today? Are you going to call your doctor up and ask questions?
I think it's important to, number one, do your own self-exam, kind of see if you have any symptoms. The most common symptoms are increased mass, all of a sudden a lot of swelling in the breast. Sometimes people have pain, sometimes people have rashes. And if you're concerned, contact your doctor. Most patients who get breast implants should have the information on their implant. Usually when we do surgery, we give them a little card that has the manufacturer, all the data, all the information about their specific implant. So number one is to find out what type of implant you have.
What would you ask? Like if you're going to call your doctor today, you would say?
You can ask them get your copy of your records, ask them what type of implant you actually had placed. And also, more importantly, what kind of symptoms are you having? It's important to know that this type of symptom does not occur right away. Sometimes it takes a year, up to 7, 8 years afterwards. And the FDA does recommend patients with silicone implants remove and exchange their implants every 10 years anyway.
Okay, so can you, one more time, just so I can get the information out to someone, because there's a lot of medical stuff and it kind of goes over someone's head. What exactly is the implant that women would be asking for if they have?
So this is a Allergan BioCell textured implant.
Got it, got it. You'll write that down. We'll get that posted somewhere for you. And then if they do have it,
correct,
what do you do?
So there are a lot of things that we do. Number one is do a good physical exam. There are some imaging studies like ultrasound, MRI, sometimes a CT exam. We can actually take a sample of the fluid that may be surrounding that cavity. The lymphoma itself is very, very specific. It is very rare, very, very specific, and it's actually in the capsule or the scar tissue that surrounds the implant. And the treatment in most cases is basically removing the implant and removing that scar tissue.
Would you want to remove it though if you have it and you're not showing any signs of cancer? Would you still want to remove it?
No, the FDA is not recommending. There are probably hundreds of thousands of patients in this country alone who actually have this type of implant currently. So the FDA is not recommending that people go and remove their implants, only if you're symptomatic, and just stay in touch with your surgeon and make sure that everything is good.
Okay, good information, important information. Dr. Sadrian, thank you for being here.
Thank you very much. I appreciate it.